Hey everybody, Dr. Ben Edwards here. Welcome to our first YouTube Live video. Excited to be announcing this Veritas Wellness endeavor that we're doing. So about 8 years ago, started Veritas Medical, and that was because I saw a different way to treat people, a better way to treat people, integrative functional medicine that tries to address the root causes of chronic disease, produce better outcomes than the conventional training that I received in medical school. So it was really cool, and it was a great transition in my career to be able to really help people address these root causes of inflammation and see symptoms and diseases go into remission and people become symptom-free. Of course, the literature's clear, whether it's cancer, heart disease, coronavirus, really everything is not genes, and it's not the germ. So the germ theory, Louis Pasteur, that kind of died. Nobody probably remembers Claude Bernard, one of Louis Pasteur's contemporaries, said, "The terrain is everything, the germ is nothing." An urban legend has it that Louis Pasteur recanted on his deathbed and agreed with Bernard and said, "You're right, the germ is nothing." Fast forward, 100 years, we get to the gene theory. We thought genes ran the show. When we did the Human Genome Project, we thought we'd figure out the cure to every disease when we just figured out all these genes. And that has turned out to not be the case either. Epigenetics is where it's at. Epi means above the genes. So it's not the germ theory, it's not the gene theory, it's epigenetics, it's the terrain. And so really what I'm saying is, this has nothing to do with your doctor. This is all about you, your diet and your lifestyle. How much do you sit? How much do you smoke? How much sugar do you eat? How stressed are you? These are diet and lifestyle factors that influence your internal terrain, your gut flora, your hormones, your mineral status, all these things that make up your what we call terrain. So with that understanding and knowledge, and understanding that it doesn't take a doctor to help you steward your epigenetics, your terrain, your diet and your lifestyle, we've decided to launch Veritas Wellness, which is an education-based platform. It'll be mostly online and virtual, although for local Lubbock residents, we'll have some live events too. But mostly this is designed to reach the world with the truth. And I think as coronavirus is showing us right now, the world needs the truth, as everybody is overreacting. And I'm not trying to downplay the deaths from coronavirus or the death from influenza, the death from anything, but it's clear that things that will put you at more risk and make you more susceptible to not only infections like coronavirus and influenza, but chronic disease too, it's all related to your terrain. It's all related to epigenetics. It's all related to diet and lifestyle. I'll give you an example. There's an increased mortality rate in China for men as opposed to women, and they were trying to figure out the reason for this, and then I read a study just the other day. The angiotensin receptor, it's a receptor in the lung, and it's one of the receptors coronavirus uses to get into our bodies. Well, the angiotensin receptor is upregulated, meaning you make more of them, in a lung that's exposed to smoke. And 60% of men in China smoke, and only 4% of women do. And then you add air pollution on, anything that's a inhalant like that, that's a toxin to the lung, it's going to stimulate this angiotensin receptor to upregulate, and the coronavirus gets in easier. That's one example of an epigenetic factor, a diet and lifestyle factor. So yeah, people that have not stewarded their health, they're diabetic, their immune system's compromised because of the high sugar and high stress and other reasons, or gut flora, your gut flora interacts with your immune system cell in an amazing way. So if you have not stewarded your gut flora, if you've eaten processed food, antibiotic-laden food, 80% of the antibiotics made in America are put into the food. And if you're eating that food, you're killing your gut flora. Artificial sweeteners kill gut flora. There's a number of things in the standard American cheap and convenient and addictive diet that kills your gut flora. Well, the gut flora is the backbone for your immune system. So yeah, Americans are going to be susceptible, and other people will be susceptible that don't know the truth, that don't know these facts, that don't know that their stewardship of their gut and their health and their overall well-being it's all in their hands. So coronavirus should just be a cold that you simply get over and you don't even know you had it, or you have minimal symptoms. That's how it should be. But people that don't steward their health are going to be in trouble. But we need to remember that America has the worst health outcomes across the board for all chronic disease. I mean, from babies to the grave. So our infant mortality rate is worse than any other industrialized country. Pregnant mamas, we're the most dangerous industrialized country to deliver a baby in. We have more complication in maternal death. Overall longevity and lifespan in America is shorter. We die younger than any other industrialized country. We have more chronic disease, more obesity, you name it. All these diseases are escalating on a hockey stick kind of curve, this exponential rise, because we've had such a dramatic change in our diet and our lifestyle, mostly stress and sitting over the last 50 to 60 years. So it's not your genes, can't blame the germ, it's all about your terrain. We talk about the measles vaccine coming in 1963 or 65, but the infant mortality rate from measles had declined by 98 to 99% prior to the vaccine. How did that huge decline in measles mortality happen? Because we cleaned up the environment. People's nutritional status got better, and then the sanitation got better. And when that happened, measles mortality rate plummeted by 99%. So it's clear. If you really go back and study medical history, you study the last 100 years, you study the last 50 years or the last 20 years, this huge rise of chronic disease, infectious disease, whichever way you want to look at this, it's all related to your terrain. So that brings us back to Veritas Wellness. In a lot of ways, integrative or functional medicine is a green version of pharmaceutical-based medicine. What I mean by that is pharmaceuticals treat symptoms. High blood sugar, that's a symptom. Insulin resistance is the cause of diabetes. If you're just going to treat blood sugar, you're going to have diabetes forever. So don't just treat the symptom of high blood sugar, treat the cause, insulin resistance, and eliminate your diabetes. But it's like that across the board. So high blood pressure, migraine headaches, all these chronic fatigue, fibromyalgia, ulcerative colitis, all the autoimmune diseases, it's smoke from a fire, this fire of inflammation. So determining what's driving your inflammation and then remove that from the body. That's what it's all about. So in a lot of ways, some integrative and functional medicine clinics will treat symptoms still with supplements and IVs and herbs and different things, and that's okay to a degree. You're going to have less side effect profile. But honestly, you don't need a doctor to get well. The doctor can't cure you. The name of my podcast is You're the Cure, and that's because that's true. You hold the keys to your own health. But you need the information and you need the knowledge, and so Veritas Wellness has been established to bring that truth of wellness to you, bring you the information, bring you the knowledge, bring you the resources, and we can point to some evidence, a lot of evidence. I've got a whole lot of slides that I'm not going to show you today. That'll be presented in the class if you need the evidence, but then some of this has to be common sense. I mean, your great-great-grandparents and ancestrally, looking back at some of these ancestral cultures, they just had a wisdom about them that produced health. And so we can glean a lot from that, just our own ancient wisdom. So we got to be careful putting too much stock in science. And in the wellness class, you'll learn about how science has been corrupted. Some science, a lot of science actually, even leading the editor-in-chief of The Lancet and the New England Journal of Medicine, two of the most prestigious medical journals, both these different editors, basically saying it's hard to trust science these days. I'll show you those specific slides during the class. And the point is there's a bias. Everybody's got a bias, including me. So we just have to know these things. We have to know there's a publication bias. So if there's 20 studies on Tamiflu that come out and show it doesn't do anything, it does not benefit you at all, well, those studies just won't be published. It's called publication bias. This is well documented now on Tamiflu, and there's some countries trying to get reimbursed for the billions of dollars they spend on Tamiflu because it's not an effective drug, and that publication bias kind of hid that fact from us. So these are the kind of things you need to learn and understand, and learn to use your good judgment when it comes to treating your health. You know, doctors are trained in evidence-based medicine, but if you look back in 1995, the original definition of evidence-based medicine, it had three factors in it. Number one, it was, yes, look at good evidence-based peer-reviewed medical literature. But number two is consider your own clinical experience as a physician. And then thirdly, consider your patient's values and beliefs. And the patient's values and beliefs trump clinical experience. And clinical experience trumps the literature. And we got to remember that. Everyone's kind of forgotten that, especially doctors. And we just think, well, if a study was produced, then I'm going to run with it. Well, we got to be careful because of that bias. So I do want to tell you my bias is that we're created by God perfectly, that the body's designed. We're not a product of evolution, of slowly evolving over billions of years from pond scum, so we're just not highly evolved enough yet, and therefore we're defective and we got to micromanage our physiology with some man-made pharmaceutical. I don't believe that. So that our philosophy is based on a design, and we'll talk about that in the class too. And most scientists actually that have gone far enough down that road, like quantum physics, I don't know that they'll come out of the closet. In fact, there's a book called Science Set Free that they talk about this, how privately all these scientists understand there's got to be something supranatural, something outside the natural, but then they can't admit that publicly because their funding for their research could be compromised. The point is, that is my bias. I believe we're created and designed perfectly, and if we just give the body what it needs, avoid what it doesn't, it'll function, just like your vehicle will if you give it what it needs and avoid what it doesn't. You should stay out of the shop. Your vehicle should function normally. We get it with our vehicle. We don't get it with our bodies, though. So the wellness class will teach you these things and explain it, connect the dots, bring in the science, bring in the clinical experience, bring in patient experiences. And the bottom line, we're here to teach you how to steward your health so that you won't need a doctor. Now, doctors are great when you're in an auto accident or some kind of trauma, but other than that, your body should function normally. So we need to learn how to not need a doctor. And that's the whole point of Veritas Wellness. So the 4 pillars of nutrition, hydration, movement, and peace, that's the foundation of what we believe at Veritas. That's the foundation of the wellness class. It's an introductory class, 6 weeks long. I'll give a lecture for 1 hour once a week for 6 weeks over the 4 pillars to tell you the why behind everything. But then there's wellness navigators. That's our version of a health coach. And these wellness navigators can walk with you with some one-on-one interactions, group visits, and then also an online forum to build that community online, and because the online communication is so convenient. So there'll be daily interaction with the wellness navigators on the forum, along with one-on-one visits and group visits. So the idea is to teach you the why, and then the navigators will teach you the how, the practical steps of how do you do this? How do you live in America and not be a standard American in your diet and your lifestyle? And I think once you know the why and you have the knowledge behind it, we connect the dots and the light bulb moment, aha moments go off, it makes it a lot easier. But then you still need the wellness navigators to actually show you how to grocery shop, how to cook, how to eat out, how to eat when you're on the road, how do you move, how do you de-stress, these basic foundational things. So we're super excited to do this. I truly believe if someone can nail the 4 pillars and really get educated and supported, they won't need Veritas Medical. So our goal is to spread this not only across West Texas, all of Texas, the United States, and the world. So this class will be offered live streamed virtually from anywhere in the world. So tell your friends, your neighbors, your loved ones, even outside the country. We want to try to affect as many lives as possible. So join us at veritaswellness.health is where you'll find more. There'll be an option there to contact us through that website for more information, for all the details and how to sign up. So I encourage you to look at veritaswellness.health. I can't let this broadcast go, though, without talking just a little more about coronavirus, because I haven't spoken publicly about it yet. And I will be more and more in the coming days, I'm afraid, because of the chaos that we're seeing around the country and everything closing down. It's an extreme reaction. Unfortunately, that's where we're at as a society, because we don't have the truth in us and we don't understand how the body was designed to fight this. And unfortunately, there's been some inaccurate information, or, you know, I'll take the high road on it and say maybe people are just not fully informed enough on what are the best ways to prevent coronavirus, because I've heard from numerous sources, not just local but national, that one of the best ways to prevent coronavirus is to get a flu shot. And it's been well documented that the influenza vaccination increases your risk of getting coronavirus, amongst other viruses. Let me find that screenshot real quick, I think. I just saw an article this morning. Here it is. This was a pretty prestigious journal, vaccine journal. Here's the Name of the study: Influenza Vaccination and Respiratory Virus Interference Among Department of Defense Personnel. So basically they looked at Department of Defense personnel that had influenza vaccine, and what they found was an increased rate, I'll show you here, 36% increased rate of coronavirus, a 51% increased risk of metapneumovirus. So there's tons of viruses out there, tons of influenza viruses out there. The flu shot covers for about 3 of them. There's para-influenza. There's 10,000 different viruses that act like the flu, basically. But the coronavirus is another group, and metapneumovirus is another. And these are 2 that specifically increase risk if you get a flu shot. That's one example of knowledge that you need to have. So when you hear a pharmacy, commercial, I won't name the pharmacy, but when you hear over the loudspeaker when you're walking around the grocery store and pharmacy, come get your flu shot, you need to be informed, fully informed. And unfortunately, we're not fully informed. So that's one example. Another thing I want to point out with coronavirus is, I already mentioned angiotensin receptor. That receptor upregulates when you smoke. And so if you're a smoker and chronically diseased and that kind of thing, you're going to be susceptible, no doubt about it. So what I would tell you is, or if you have a loved one, a family member, is there are reports now, I have one here coming out of China, they're using high-dose vitamin C intravenously and seeing improvement. These are in the really sick patients in the ICU, septic patients, acute respiratory distress syndrome. That's when the lung basically starts to shut down. And so this report talked about the hospital in Shanghai is using, I believe it's 10 or 12 grams of IV vitamin C and seeing decreases in mortality. But we've seen this over time before coronavirus. This was a study in 2018. I don't know if you can read that, but hydrocortisone, which is a hormone, a steroid hormone, vitamin C and thiamine. They gave half the people this injection, half the people did not. And this was in septic shock in the ICU. And the mortality rates were significant. 8.5% in the treatment group mortality rate versus 40% in people that weren't given that concoction of vitamin C and thiamine and the hydrocortisone. And there were other benefits. None of the vitamin C group developed progressive organ failure. So with sepsis, all your organs start to shut down, your kidney, your liver, your heart, and you die. There was no progressive organ failure with the vitamin C group. And then the vasopressors were able, that's a drug that keeps your blood pressure up, because with sepsis, blood pressure drops. So the vasopressor group, they were able to stop the vasopressors at 18.3 hours with the vitamin C group versus 54.9 hours in the non-treatment group. And that's not the only study. There have been studies in the past. Here's one, vitamin C for severe sepsis. And this was from 2014 to 2017, the Citrus Ali study. And there are lots of prestigious institutions in the study, including Cleveland Clinic. And they looked at overall 167 ICU patients with sepsis and acute respiratory distress syndrome. So ARDS, A-R-D-S, that's what's going to kill you with coronavirus. Your acute respiratory distress syndrome is this syndrome of the lung basically just being so inflamed and so infected, you can't move oxygen into the body. So even if you're on the ventilator putting oxygen into the lung just can't get it into the body. That's ARDS. So with these 167 ICU patients with ARDS, they did the IV vitamin C. You can see the rates here, 50 milligrams per kilogram vitamin C and dextrose versus placebo every 6 hours for 96 hours. And the outcomes, you had a 29% mortality rate with vitamin C and a 46% mortality rate without the vitamin C. So these are super sick patients. They're septic. They're going in that organ failure. They can't move the oxygen. And there's definite benefit with the vitamin C. So unfortunately, we're not hearing all of that. Your doctors probably don't know this at all because it's not taught in medical school. I didn't get taught anything about vitamin C. I got 2 hours of nutrition and 4 years of medical school. Nutrition. Our vitamins, our B vitamins, C, D, E, all the vitamins, the minerals. These are the foundational components of your immune system and of your whole body. So obviously if doctors don't learn about this, then we're not going to be able to speak educatedly and clearly about it, even though there's published data on it. And that's unfortunate, but that's the point of the class of Veritas Wellness, is to teach you these things, inform you of these things, so that you can come away with an understanding that United States medical schools train doctors very, very well in pharmacology, pathology and pharmacology. We know how to diagnose them, and then we know how to treat you with a drug. We're really not taught too well with biochemistry, anatomy, the actual how the body works, and then the nutrition part of it, how to support those natural mechanisms in the body. How does a white blood cell naturally gobble up the coronavirus? And how can you support and stimulate that naturally? We don't learn those natural things, unfortunately. We just learn the pharmaceutical-based approach, which, again, can have some benefit, but when you can combine them, and hopefully if your diet and lifestyle is good enough, you'll never even need the pharmaceutical approach. But as we saw with that study, if you can combine the ICU treatments with vitamin C, your outcomes are better. So don't worry about coronavirus. Obviously, don't smoke. Cut the sugar. Sugar impedes your white blood cells from gobbling up coronavirus and other viruses. You want to fill your body full of nutrition, especially the minerals. Salt's not bad. You'll learn about that in the class. Salt, we're actually demineralized as a culture, and we need salt. Real salt, though, not man-made, adulterated, iodized table salt. More beneficial would be sea salt. So things like this is what you'll learn in the class. Again, a 6-week class, 1-hour lecture by me every week for 6 weeks to tell you the why, and then the Wellness Navigator's there to give you the how. How do you apply this? And again, this is an introductory class. We would hope that this would spur you on after the 6 weeks to want to continue to learn more from us and just learn more in general about how to steward your health. So our class will start March 25th, I believe, is the date. But go to veritaswellness.health for that, for more details, and to email us, to contact us for those details. And again, I encourage you to spread this far and wide to all your relatives, friends, and family around the globe, because unfortunately we've exported the Western diet and lifestyle to many people around the world. And so we need to bring the truth to them too. So thank you again for joining us today. Look forward to more YouTube Live in the future. Y'all be well and do not fear. Fear, I believe it's 400 plus times in Scripture it says, fear not. So fear not the coronavirus or any chronic disease, but come learn how to not be a standard American and how to live a long and fruitful and healthy life. This is Dr. Ben Edwards with Veritas Wellness. Look forward to seeing you in class.